Great. Good morning and good afternoon and good evening to everyone who's dialed in, and a warm welcome to you all. Today is our session 2 on decarbonization of humanitarian infrastructure webinar series, and we're really pleased to have you online. As you all may know, this is a joint effort by the International Red Cross, ICRC, Energypedia, and the GPA Coordination Unit at UNITAR to really share knowledge and experience on energy access work in the humanitarian context. And my name is Amy Jinks, working with the GPA Coordination Unit, and will facilitate the webinar today. So a little background on this series. Today is our session 2, and it will be really technical in nature, focused on understanding how to conduct an energy audit and develop a technical case and a project plan for solarization of energy infrastructure for humanitarian facilities and help posts. Session 1 is already recorded, which you can find on Energypedia, and that was just a framing. And then session 3 will be coming up at the end of November, focused on some real life case studies to see how we kind of put all of what we learned today into practice. And before we start, we just have a few housekeeping rules. So we'll be taking questions throughout the webinar today. We'll have 3 presentations followed by a Q&A session with our fantastic panelists. And so please be sending in your questions throughout. Please indicate who your question is to, so presenter 1, 2, or 3, or their names, so we can know who you're asking your question to. And if you're dialing in on a phone or a tablet, you can look for the question mark icon, and a chat box should appear, and you'll be able to type in your question there. Moving on to the agenda. Today we have 3 really quite interesting and in-depth presentations. The first is an in-depth review from our renewable energy expert, Mark Hankins, on how to conduct a technical energy audit on energy infrastructure powering humanitarian facilities, with really particular insights and hands-on experience on kind of how this differs in the renewable energy or the humanitarian sector versus kind of normal rural electrification work. And he'll be sharing some firsthand experience from South Sudan and other contexts. And that will be followed by a presentation on from Sarabi from Selco Foundation on the tips and tools for conducting ecosystem assessments on energy needs for health clinics. And we will close out by a presentation from our colleague Peter, who will present on the Homer Energy, an open access app and user-friendly kind of system sizing tool for humanitarian health facilities. So without further ado, I will welcome today's first speaker. Oh, sorry, before that, we'll have a quick poll. You can launch the poll, Fernanda. I just want to know a little bit about where you're dialing in from. So on your screen, you should see a poll. So if we just take 30 seconds to ask where you're based, we'll give it a little bit of time so people can respond. And we'll close it out and see the results. So mostly in Africa and Europe, followed by Asia and North and Latin America. Welcome, everyone. And our second poll question and final one, in which sector are you working? So please let us know if you're with an energy or humanitarian organization, a private sector or a research institute or other. So give it a few seconds. Great, so a majority dialing in from humanitarian organizations and private sector, some from energy and research and other. So, great, thanks for letting us know. And now we'll move on to welcoming our first presenter. So it's a pleasure to welcome Mark Hankins, who is really a pioneer in rural electrification and renewable energy, mainly based in East and Southern Africa, with over 25 years of experience in advisory and engineering, specialized really in commercial market development, training, systems engineering, and project development. And he'll be giving us quite an in-depth presentation over the next half hour. So with that, I will hand it over to you, Mark.
Sure. Should I turn on my webcam? Not
yeah,
yet.
if you can, that would be great. Thanks.
Okay, so the title of my slide is Conducting an Energy Audit and Developing a Value Proposition for Decarbonization. And actually, I'm going to start with the second half first. But if you could switch the slide, please. So the objective of the sessions is to provide technical input to support practitioners in transitioning to renewable energies. It's really good to see so many people from the humanitarian sector, because I think that's where we need the change to come from. The energy sector in East Africa. I'm sitting in Nairobi right now, where I've been based for 30 years, and we need to help the humanitarian sector to do what the energy access sector has done over 30 years. Energy access sector has made a lot of progress, but the humanitarian sector, it's a recent entrant in switching over to improved renewable energy sources. New slide, please. Next slide. So I'm going to talk about four main topics. And the first one is what's unique about the humanitarian context as opposed to normal renewable energy development, which is mini grids and off-grid solar, or even grid connect solar for development applications. Second part, I'm going to talk about, well, what do we need to do to make the transition to sustainable energy sources? And then I'll go briefly into the process of conducting an energy audit and developing value propositions. And then the last part of my talk, I'm going to give an example from South Sudan of a site. I did last year. I looked at 11 sites in South Sudan, and I'll present how we went about that one of the sites. Next slide, please. So the humanitarian context. So what is it? What is unique about the humanitarian context? Next slide. Right. Well, 5, 6, 7 years ago, I would go to refugee camps, and I talked to managers, and they'd say, like, well, we don't want to experiment with solar. In most refugee camps, humanitarian situations, grid power is unavailable, the remote. But there's a pressure on relief operations to work 24/7. That means they can't afford to have the power go off. If they're pumping water, I'm focusing mostly on electricity, but I can talk to the energy for cooking side. But my experience and in this presentation is mainly talking about electricity. So if they're running generators, they need those generators. They need that electricity 24/7, and that's not necessarily true in the development context. The next major point is they often have large loads. You'll find a UNHCR office or a hospital with air conditioning, and a small solar system can't supply that power. So, well, it couldn't until recently. So they'll say, no, we're going to go with our genset. And finally, there's confidence in generator technology. It works. There's an infrastructure to repair it. So if something goes wrong with the genset, you can call a technician from the company that supplied it, and they'll be able to fix it. And it just works. You turn the generator on when you need it, you turn it off when you don't need it. But the negative side is they're costly, fuel hungry, dirty and wasteful, and of course CO2 emissions. And it's the wrong message to the communities. You can see in the picture that the large generators, they make a lot of noise at a site in South Sudan, and you can see the drums that have to be transported and stored. And so these drums are just stored under a tree. Not good. Next slide. So they as much as humanitarian agencies want to make the change, they need to be confident that the technology is going to work. And another major problem why relief agencies don't integrate sustainable power into their operation is poor capacity of solar renewable sector. So quite often, South Sudan is no Kenya. A lot of the companies that that want to get the jobs don't have the capacity to provide a solution which can meet the strict requirements of the humanitarian agency. A lot of humanitarian agencies have had a bad experience with technology. That picture is a 2 kilowatt solar system that was installed at great expense by NRC, Norwegian Refugee Council, and it's not working. It never worked, and it's because the inverter had a fault and nobody could fix it. So they've had bad experience with technology, so there's a lot of solar systems that just aren't working. So if you're a manager of an agency, you're like, well, can I trust it? The third thing is procurement approaches. It's much easier to do a procurement for a 150 kVA generator or a 50 kVA generator than it is to do a procurement for a solar system, because the 150 kVA generator doesn't need a design. A solar system needs a design, and the procurement approaches a lot of agencies really don't budget for the upfront and preliminary work that needs to get done. And then solar costs are high. You're paying for 30 years of electricity or 20 years of electricity up front, and a lot of agencies are running year to year on budgets, so they can't put aside the 5-year costs for a solar system. They only have their budget allotments, which are really pretty much made to fuel gensets, and gensets are cheaper because you're not paying for the fuel. So with their budgeting, it's much easier to fund the yearly costs of buying fuel than it is to pay for a pretty large solar system all at once. And so that's a big problem with humanitarian agencies. And as I mentioned before, confidence. They love their generators, they work. Next slide. However, the good news is that the tools for the transition are available today. Solar energy, efficient appliances, storage, batteries, and electric transport is available. And it's actually in the long term lower cost than trucking and fuels. It has much less environmental footprint, but the solar and electric transport industry are mature. And in Africa, increasingly, there is regional experience. If you're in northern Uganda, you can go to 10, 20 solar companies that actually do have the experience now. We didn't have that 10 years ago. We've got the regional experience now. Business models are available, and as I said, if you can finance those solar systems with a financing business model, then you can talk to the CEO of the refugee organization and say, well, how about we finance this for you for 5 years, and it's going to be cheaper than fuels. So business models are available, and we're seeing a major investment in the African solar sector and company appetite. Last few years, we've seen $2 billion of investment in East Africa alone in solar energy, just for off-grid. So the investment's coming in a big way, which it wasn't coming in 10 years ago. And there's a large potential to build solar use on the back end of refugee camp installations for NGOs, for communities, and for the private sector. And finally, 80% transition is viable and cost effective. There are some sites where you're going to have to stick with generators, and we can't do 100%. But to get 80% of the energy needs for various sites is possible. Next slide. So moving quickly, how can we assist this transition? Well, we need to learn the lessons from energy access. And there's a lot of great stories in energy access all throughout Africa, but especially in East Africa. Learn those lessons. Secondly, use the refugee and relief activities as anchor loads, which enable companies to come in and invest in these regions. And we need to encourage supply companies to move into the relief sector. When I talk to mini grid companies and solar companies, they say, "Well, I focus on rural communities. I don't know the relief sector." So we need to get the relief sector talking to the energy access sector. Next. So making the transition to sustainable energy sources. How do we do it? Next slide, please. Okay, so there's three general things that have to happen as we make this transition. One, we need to look at energy and sustainability management as an operational cost. So we need to better manage energy use and appliances and investments at the office level, especially in off-grid rural communities. What do I mean by that? Well, we need to look at the cost of energy as an important cost of operations, and we need to figure out, okay, let's get more efficient at using our energy. Let's not use wasteful air conditioning where it isn't needed. The second thing that needs to happen is we need to build local capacity. Providers need to stand behind equipment for its operational lifetime and be able to supply the spare parts. What's been happening in the humanitarian sector is a lot of times procurement, that someone sells equipment, make their sale, and they get out of there. And they don't stand behind their equipment. So they leave a solar system orphaned, and there's nobody to fix it because the company has moved on. So we need to build the local capacity to do the O&M work, and also to supply the spare parts. And if you need to replace the batteries or the inverters, have someone available that can do that. And then finally, we need to take an investment approach to sustainable energy. And that means investments in solar energy need to be made per unit of energy, financed, and as I'll say a couple times, move away from procurement-based approaches. So if we can get the companies that are now financing mini grids or financing pay-go solar for energy access communities, if we can get those companies that are quite comfortable financing solar for rural communities to finance solar for the humanitarian sector, then it's a win-win. So energy sustainability management, building local capacity, and investment approaches to sustainable energy. Next, please. Next slide, yeah. So just a little bit of details on that. How do we integrate better energy management? Well, there needs to be a business arrangement between the supplier of equipment. So that company, it's either a PPA, pay-as-you-go, or a purchase, but the business that sells has to be around and has to say, okay, we're going to support that. Secondly, make energy a job responsibility. It might not be a full-time responsibility, but someone in that humanitarian sector office has to have the job responsibility of taking care of the solar systems, just like they do for transport and managing generators. We need to do better sourcing of the smaller PV and backup systems. So what I've seen is a lot of very, I'll say the word crappy solar systems just because they're not properly procured. And those systems with poor batteries or poor inverters that really aren't made for rigorous circumstances, they stop working. So we need to really get better quality and do better procurement. There needs to be an energy management plan in the humanitarian sites, and that means they need to know how much energy they're using, and if it's too much, try and reduce it. As I mentioned, better quality electric system installation. So the technicians need to be qualified. People need to keep records so that they know how much they're spending. And then we need to replace inefficient appliances. So if you've got an electric cooker that really isn't needed, that needs to go. So if you need to say these are equipments that aren't necessary as appliances for the site. And then you need to look at investment and not just procurement in renewable energy and energy efficiency. Next slide. So that's a picture of an electric vehicle manufacturing plant in Nairobi, just as it's Opibus. So electric vehicles are coming, just wanted to point that out, but we need to have standards. We need to have a PPA approach in the investment, local and international cooperation. So quite often, the company that wins the bid is an international company, but it has to have a strong local partner. So that kind of needs to be required. This is something that we worked on in both South Sudan and Mindanao, where I recently managed a tender. We partnered international companies with local installers and service providers. And then there needs to be donor and community project collaboration. So if donors are investing in the communities and the relief sector is investing in the camps, then partnerships between these two is win-win. And this has been happening in Kakuma, which I think is mentioned elsewhere. Next slide. All right, building local capacity, and this is a challenge everywhere. But if we're gonna make these systems work, there needs to be someone to fix it. So a multi-level approach to solar development has to happen in the field, has to happen in the capital city, and it has to happen among the companies that are supplying so that they can meet the specific needs. So capacity has to be built, and there needs to be some type of standards and regulation. Incorporate the local experiences. With 30 years of experience in East Africa building up the solar sectors, we need to bring in those local solar companies and technicians that can work in the camps. Involve training institutions, and then keep moving here fast, but we avoid duplication. Let's not do the same thing over and over if it doesn't work. So donors should and refugee agencies should be looking at what other people are doing and complement approaches instead of duplicating unsuccessful experiences. Next slide. So let's look very briefly at conducting an energy audit and developing a value proposition. So next slide. There's two parts for this. The first is the organizational context, and this is really important. There needs to be a full buy-in from the agency. So quite often, one of the problems that I run into is the agency doesn't have the budget, but they want to go green. Budget has to be available, and the agency has to have that budget, or it needs to figure out how it's going to get the budget. And expertise and quality equipment are a must. And I say it over and over again, but you know, for South Sudan, a lot of the people that are in the procurements are just people trying to win a bid. They don't know about solar panels, they don't know about batteries, but they know the procurement officers. And so a lot of failure comes because some procurement officer is dealing with someone he met over dinner and over a drink, and they say, "Oh, I can supply solar panels." That's not the way we need to go. There needs to be expertise at every stage. So you need an organizational buy-in, which includes planning and budgeting. You need understanding of the technology situation and the limits of the technology. And when I say limits, what's the maximum? If you're running 35 air conditioners, the chances of that being able to be powered by solar at a reasonable budget is not there. So we need to understand what the technology limits are. Then we need to do an energy and site audit, system sizing and design, and I'll come to that. Then we need financing and procurement. So the financing needs to be made available, and more it is. There are more and more companies that are able to finance systems, but the procurement methodology needs to be doable, meaning that the procurement methodology has to fit the solar equipment. And a lot of times the procurement methodology fits generators a lot more than it fits solar equipment. So we need to get that financing and procurement step in place. And then there has to be an after service and management of the system. So that needs to be in place. That's organization of the organization of the humanitarian agency. The next one is the technology context, and this is a similar process, but it's not the same. So let's look at, and this is the core of what needs to be done if somebody is getting a solar system for a site. First, there's an audit. And the audit study is a list of appliances, a usage, power requirements, planning for the load growth. And we quite often use loggers, data loggers on big sites, but this audit it requires expertise. There needs to be an energy expert that actually conducts this the audit. This isn't something for a layman to do. We had to do this in Mindanao recently, and it was a disaster because we had to use lay people because we couldn't move because of COVID. And there's documentation for this process. Design. Once you've done the audit, it needs to go to someone who can design a solar system, and I think we'll be hearing the next session more about that. So we need to design the solar array, battery, inverter, charge regulator, and balance of system, and that needs a qualified solar designer. And there's a document that comes out of that. Then there's a whole procurement, which is there's a procurement process. So the design gets handed to the procurement department, and the procurement officer actually needs probably to be advised by a solar designer, because when they review the bids, somebody needs to understand what the bids are. And so there's documents for that part. Then you go to the install. The installer has to have the tools and the expertise to do that. And there's a documentation trail for that. Was it certified? Was it inspected? Was it commissioned properly? So there's a number of steps that has to happen in the install side. And then after when the installer leaves, then you come to management, and there needs to be some tools for that. There needs to be an operator, maintenance technicians, and some documentation of the system. The great thing is we now have online tools for a lot of this equipment, so a lot of the management can be done online, but you still need a maintenance person and an operator. Anyway, that's the whole picture of the audit. Next slide. So there are a lot of different ways to do energy audits, and I find that it quite often depends on the client, but virtually every audit needs a similar set of documents. We use a spreadsheet, but you'll hear about Homer. You can use a Homer type tool, but you're going to need the site information type and specific needs. You're going to need information about the current energy systems, including electricity and fuels used. You're going to need information about all the key appliances and their use patterns. You're going to need a qualitative assessment of the energy supply as it is now, including gender and poverty issues. And then you're going to need to know what's the energy demand profile and growth. So what does it look like over 24 hours? When's the peak? What's the maximum? And how is it going to grow? If you add a solar system and they add 5 more air conditioners, then you've got a problem. So then you need to know about supply chain and the private sector maturity considerations. If there isn't a private sector in place, then the procurement process really needs to consider, well, how are we going to get a good company to do this for us? And then you need to know, what are the end user needs? How do they need to be trained? So how do they need to be trained to operate it? How do they need to be trained to efficiently use the appliances? And there's management and financing considerations for end users. So there's a whole list of things that need to be done in an energy assessment, but there are various tools available for that. Next slide, please. One size does not fit all. Large systems will be very different than the smaller systems. I find that many of the offices need a very small system, like a 5 kilowatt system. The big companies are interested in the large system, but quite often an NGO office just needs a 5 kilowatt solar system. And so depending on whether it's a large or smaller system, there's different investment capacity building, business model, and coordination needs. So when you're doing the design, you need to consider, is it going to be a large system C&I approach, commercial industrial approach, or is it a smaller mini grid or standalone approach? Very important. Next slide. All right, I've got a few more minutes, and I'll take you through what we did in South Sudan when we were developing a bid document for NRC in one of their centers. So next slide. Okay, so we were looking at we're looking at Awiel office, which you can see in South Sudan. This is quite isolated, very hard to get to. I actually think I had to take a helicopter to get there. So not easy to get to, and when it's raining, you can't deliver anything there because it's way too muddy. The roads are flooded. So there's Awiel. Next slide. So the overview, it's the location. It's in a town. There are 20 staff. They have a pretty large compound, and they're using they use 23,500 liters of fuel. So NRC was able to show us that, and the cost was $1.30 per liter. So electricity costs for them was over almost 60 cents per kilowatt hour. Next slide. So we looked at their power system that they were using at the time. They used 2 generators, 13 kVA system, small one for when the air conditioners weren't on, and 110 kVA system when the air conditioners were on. So they operate the generators during business hours, 14 hours a day. Electricity is 3-phase. Both generators were working. They had a small solar system, which was just powering critical loads in the internet. And we also noted that the ACs, the doors were left open. So when they were running the ACs, they were air conditioning South Sudan, which isn't very efficient. The wiring of the site was really poor, and the PV and solar systems operate independently. So we looked at the power system. Next slide. And then we looked at the loads, and you can see that they're using 177 kilowatt hours a day in the hot season. The peak demand is over 50 kilowatts, and if you look at that little bar chart, you can see that cooling, 90% of the energy is for cooling. So that's you can run that office with a pretty small solar system, but you're gonna be spending 90% of your money just to power air conditioning, and a lot of times the doors are open. So that's an interesting observation. Next slide. So we came up with a design, and I've got a minute and a half left, but I'll just show you. So what we did was, instead of designing the full solar system, we designed the system with what we call output-based designs, meaning that this is what we want the providers to supply. So we want them to be able to supply we want them to design based on 5.16 kilowatt hours a day of insolation. We want a battery reserve of 1.5 days. We want the system to be 48 volts. We want the daily system charge to be 3,681 amp hours a day. I'm a little bit technical there, but at 48 volts. We want the solar array to produce 713 amps at 48 volts. So we need it to be about 40 kilowatts. And then the module features, the array mounting, and the earth and lightning protection have to be there. Next slide. So then we have our charge regulators, what requirements and recommendations, and battery bank. So we're designing 11,000 amp hours at 48 volts, 3,500 cycles. So we have our battery bank requirements and recommendations. Next slide. Next slide. Yeah. So then inverter charger requirements. So their ratings, 50 kilowatts. Inverter charger recommendations, and we want them to have a system monitoring that can be online. So I've got coming to my last slide. So that's what we gave to the bidders. Last slide, or actually 2 more slides. So we also gave them an idea of where they could put the solar array. So we showed them that there's good rooftop exposure and that they can either use a carport or a rooftop. So we provided the installers with information on where they can mount the modules and where they can put the batteries. So the information's there. And then this is my last slide. Next slide. So the final words. We need, in order to get humanitarian agencies to take up renewables, well, the good news is it does work, but we need independent energy experts, not the company selling the system. We need procurement installation to be provided with resources and expertise. The providers should ensure that the staff understands the system, and there needs to be agreements. Those that manage and provide finance or relief operations should develop finance models for large end systems, and humanitarian agencies are critical in the process of building off-grid energy infrastructure for the community as well. Okay, last slide, my closing slide. So there you have it. I really appreciate your attention. If you want any more information, I did a paper which is available on LinkedIn, and I'm happy to answer questions going forward. Thanks very much.
Thanks, Mark, for that rich presentation. And we have some interesting questions coming in for you. So yeah, curious for the discussion section. But thank you for the presentation, Mark. And now we'll move on to our second presentation. This is from Surabhi, who has 10 years of experience with the Selco Foundation and really specialized in energy financing and skills development, mainly working on bottom-up energy access planning. And she'll be sharing with us about how to conduct a kind of holistic ecosystems assessment for assessing energy demands and needs in health centers. So with that, over to you, Surabhi. I think you're muted, but we can see you. Surabhi, we still can't hear you, unfortunately. No. I wonder if you could try without the headphones.
Can you hear me now?
Yes, we can hear you.
Okay, great. Is there too much of an echo, or is this okay?
No, it works.
Okay, great. So thank you so much, Amy, for that introduction. Sorry about the headphones. And thank you to ICRC, GPA, UNITAR, and to Energypedia for pulling this together. I think much needed, especially given the current circumstances that we're in. As Amy mentioned, I represent an organization called Selco Foundation. A lot of our work is to look at decentralized renewable energy and how that affects poverty alleviation, and in a way that also enables climate action. This particular effort is looking specifically around our work on energy for healthcare and the learnings that we've had across situations of disaster, displacement, and humanitarian crisis. And I'll talk more broadly about the energy health work, some of which directly feeds in, and then touch upon some of the learnings specifically for the humanitarian context. Next slide, please. So as I think Mark has already alluded to a lot of the challenges that come up specifically around designing healthcare solutions and energy for healthcare in the humanitarian space, just to kind of step back from saying why is it that we need to work together with the health sector as opposed to kind of designing solutions on our own as an energy sector or as on our own as the humanitarian sector. There is a lack of appreciation of the linkages that come, and without that understanding of what are the healthcare gaps that are that are prevalent in these facilities, what are the kind of capacity gaps that these healthcare facilities face, it's much harder to design an energy solution that can be best utilized over time. So the approach that we've taken is to work very closely with the health sector to design the entire health energy program and health energy interventions, because often it's the gap in the inability of a particular staff to be there that prevents the healthcare delivery from happening. But you step back a little more, and the reason the staff is not there is because there isn't energy access for their own comfort for them to then be able to perform or carry out the delivery services that are meant to be provided through that healthcare facility. So the approach here is to really link the healthcare gaps, understand the underlying causes for some of those gaps, and see where energy can play a role in meeting those gaps. Next, please. The key infrastructure components that we look at within energy delivery within healthcare is, of course, right in the middle we see the medical and electrical equipment that is really required to provide these health facilities. So what is currently available in the market may or may not be what is currently available in the health facility may or may not be the most efficient one. And especially if we're looking at new facilities, it would be critical and quintessential to kind of identify the most efficient appliances, because that then has implications on other aspects as we'll come to. So the efficient appliance being one critical infrastructure component. Then of course we're looking at well ventilated spaces that also have thermal comfort, that are well lit and therefore designed for comfort of health staff as well as for comfort of the patients themselves. And powering all of this using decentralized solar. Most of our work has been decentralized standalone systems that often are on the rooftop of the health facility itself, because many of these are distant from one another. Some of these are in extremely remote areas, and decentralizing the entire energy system just makes it more efficient overall. The other aspect of our work is really to look across the value chain. So, for example, while looking at maternal and child care, it's not simply about powering the equipment at the health facility, but rather to see along the value chain how you can kind of reduce the burden on the health facility. For example, portable maternal kits, and these are solar powered maternal kits that help the last mile health workers or community workers to go out and identify things like high risk pregnancies, monitor the health of mothers to be, to determine which of them would need the most attention and then refer them to the relevant health post or main hospital depending on the circumstances of their pregnancy. We also look along the value chain to see what happens after the child is born, and then looking at aspects of immunization, of neonatal care and so on, which may be more at a facility level. Next. And the second aspect of our approach is really looking at it as an ecosystem. We know that there are multiple stakeholders that play a role in delivering, implementing, and managing healthcare facilities or healthcare solutions. And we know that there are a similar number of stakeholders managing the energy side of things. So our effort is really to work with stakeholders across these 5 broad brackets of technology and design, where we're looking at manufacturers, vendors and suppliers of efficient equipment, both medical as well as electrical equipment, clean energy enterprises, and because there is a strong built environment component, looking at architects, masons, construction workers, etc. Training and skills of health staff, of medical staff, their service delivery points, and at what points they choose to intervene. Looking at finance and ownership, as Mark alluded to, it's always harder to get financing at a later date to look at these facilities. So how do we make sure that they can be incorporated or leverage on existing available resources for healthcare to look at the energy aspect as well. And finally, at a policy level, and this goes across, national levels, multilateral organizations and humanitarian organizations, on how you look at procurement, on how you look at aspects of servicing, maintenance, and commissioning of health facility work. Next, please. This is just to give a quick sense of the trajectory of our work. When we started off, we started by working closely with a health partner named Karna Trust, where we tried to identify what the health and energy gaps were in their work itself. And moving from there, we looked at powering individual healthcare facilities. Based on their input, started looking at portable kits for their last mile community workers. And right now we're at the stage where we're working closely with state governments and state health departments in particular. So if I was drawing the analogy now to the humanitarian space, I think our effort is to really work closely with the humanitarian organizations and their health partners on the ground to understand the needs and then to design health solutions that meet those needs for the community as a whole. We're also working to across countries in sub-Saharan Africa through various partnerships, and at a kind of policy and engagement level, also trying to see how entities like Gavi, the Vaccination Alliance, the Global Vaccine Alliance, WHO and IRENA are looking at energy and efficiency in their healthcare programs. Next. So broadly, the approach to designing health energy interventions begins with an in-depth health energy assessment. We then go on to design the solution as a combination of efficient appliances, renewable energy, and wherever possible, built environment components. Looking then at the procurement and installation and the key stakeholders involved there. And while we put financing and ownership as a last piece, it tends to come across the board of how do you make sure that all of this can be funded, but also then there is financing for the implementation itself and then the maintenance of these solutions, and ownership and maintenance happening at a health facility level, also in addition to energy stakeholders facilitating that maintenance. Thanks. So quickly to start with the health energy assessments. Now the assessment itself is a process by which we pair health staff with energy, either the local energy enterprise or local technicians. And in some cases, it's often technicians who are otherwise working to maintain health facility equipment, right? So you typically would have some sort of technician or electrician in the area, and pairing that person with a healthcare professional or health staff managing the health facility to undertake an assessment where we understand various aspects about the health facility itself. So that includes things like the demographic, whether the center is one that is just a health post providing certain basic services, or whether it's a hospital providing much larger services. The kind of building, construction, existing equipment in comparison to what they want to provide as a service delivery entity. An example here from Burkina Faso, where we've been working with IRENA as well as the Ministries of Energy and Health in Burkina Faso to look at this health energy assessment across all of their health facilities in the country. This particular one is a maternal health facility, maternal health center, a private maternal health center in a remote part of the country, where doing the health energy assessment also helped us understand what kind of equipment they were missing in trying to provide these maternal and child care facilities. So, sorry, maternal and child care services. So, you know, you have a lot of babies being born prematurely or needing more support. And we know that the baby warmer is an appliance that would be used in that scenario. But without clearly understanding what level of maternal and child care this particular facility is providing, it would be really hard to determine what appliances and therefore what energy systems. So rather than restricting ourselves to what appliances they have at this point, the question is really what health services do they need to provide, and therefore what are the kinds of appliances needed for health staff to provide those services. Next. This second aspect of appropriate design, as I mentioned, is a combination of efficient appliances, built environment, and then appropriate energy system designs. While looking at efficient appliances, and again, I'm just using this sort of maternal and child care as a running theme to say that you have options of efficient and inefficient appliances. Going in today and just powering the existing facility and the appliances that are currently being there can be extremely inefficient and therefore also contribute to increasing the total expenditure, not just for today, but the recurring expenditure of powering the healthcare facility or keeping it running, right? So these appliances that we mapped out are a comparison of what is typically available in the market, which you see plotted in red, versus the most efficient ones available. And supply chains for these efficient ones is definitely a question that we would need to answer as a sector, whether the most remote parts of a country can access these appliances, and then what kind of servicing comes in. And we need to incorporate that into program design, appliance maintenance, appliance supply to be part of that program design when we look at powering a healthcare facility. But we need to remember that efficient appliances are available in the market, and incorporating them as and when we start the health assessment and as and when we start the health system design is critical to being able to bring in those energy savings and therefore the cost savings as well. Next.
Thanks, Rabi. If you don't mind trying to wrap up in the next 2 minutes.
Yeah, sure. The efficient built environment part of it, and I just put up this example because, you know, at the right side, the rightmost column that you see is looking at inefficient appliances with standard building designs. The middle one is inefficient appliances with green building designs. And then when you combine the efficient appliances and the green building design is kind of when you get the most efficient and the most cost-effective solution for a particular facility. And that particular one was for a larger hospital, but you see these kind of efficiencies play out. And what it does is, what you see on top on the left side is a picture of a health facility in a northeastern part of India, where having natural lighting and ventilation and appropriate insulation and thermal comfort really changed the comfort of health staff and therefore made it easier to ensure that staff can be retained to work in that health facility and can perform their activities and their services in a space of comfort and safety. You also find this when you go into remote areas where staff have to stay alone with, in a space that just has a small health post and are often having to deal with issues of energy access themselves, which makes staff retention a big challenge. Next. Sorry, I'm just going to take 2 more minutes before I close. What we try and do when we do the design is also to provide a set of options in terms of the most basic option of what an energy system could look like and the kind of loads it could power. As you can see, option 1 is primarily powering electrical loads. And then as you move through the options, you can look at them powering larger loads and more medical equipment and services. And we provide these options to allow for facilities to also look at what all services they want to provide at a certain point in time, and then think about the energy system that they might want to. Next, please. And finally, on the financing, ownership, and maintenance, a critical component, as Mark also alluded to, was procurement guidelines. Something we're working on very strongly is to enable health departments, humanitarian organizations working on procurement of health appliances to look at the most efficient appliances and include that within their procurement guidelines, to then leverage the funds that they have for appliances, for diesel generators, for operating diesel generators, and moving them into maintenance and annual maintenance funds that can be managed by the health facility management and can be used on an annual basis to ensure that the solar system is working, that the appliances are working, that there's regular checks and maintenances on that. The final component that is extremely critical is to make sure that the health staff are really trained to utilize this. Having a baby warmer or a suction apparatus there, but having a non-medical staff or a nurse who may not know how to use these appliances is extremely, is sort of losing the point completely. So having health staff trained to utilize the appliances, to utilize the appliances there and run them is a critical component. And of course, making sure that there are either at least local technicians or local energy enterprise that's signing on to maintaining this on a regular basis and coming in for servicing. Next. For us, the key takeaways have really been looking at remote areas, at disaster-prone areas, and the various models for healthcare delivery. Not everything has to be a health facility. As I mentioned earlier, you could be looking at portable maternal kits. You could be looking at telemedicine as a way to bridge the skill gap that may exist between the center of the town versus a camp that is far away and remote. When we look at emergency settings, and the left extreme bottom left photograph is a facility that was put up within a sort of 1 month period during COVID, because it was an emergency COVID care facility that was required in the eastern part of India and had to be put up quite immediately. So portability, mobility are design considerations that are critical to think about, and as a sector there's a lot more innovation we can do, but as a humanitarian space and as the health sector, it's also worth thinking about which healthcare facilities can be provided through these different channels. We also work in disaster settings, and the top photograph on top is in the northeast of India, where you have riverine islands and boat clinics to provide regular health care to people living on these riverine islands. The diesel generator expenses were just so high that they were finding it hard to manage this boat clinic itself. So separating the diesel generator expenses to run the boat versus solar powering a lot of the medical equipment and the electrical equipment required to run the health services was a critical part of delineating that and allowing disaster affected communities to access healthcare regularly. The last thing I just want to say, and this is sort of alluding to some work that we're doing now with UNHCR in Tanzania, looking at Nyarugusu in the Kigoma region. Nyarugusu is one of the largest camps. And as we look at the health facilities there, you start with, okay, should we power one health facility? But what makes most sense is to think about it as a cluster-based approach. There are potentially 7 to 8 facilities that that health facilities running there. And if you power only one facility, like the main hospital, you're powering all of the equipment there, but you're leaving the health post with just no energy or very basic lighting, which means the burden of on the hospital to manage everything from maternal care to diagnostics to general medical attention and inpatient and outpatient becomes so much more. So if you look at it as a cluster-based approach, you can see within the value chain whether health posts can actually take on the work of basic maternal and child care, immunization, cold chains that can be used today for COVID vaccines and in the future for child immunization and vaccination. That then reduces the burden on the main hospital to be able to manage all of that, and that changes the energy system design and appliance requirements at that main hospital as well. I think I've already alluded to the other 2 points, but maybe I'll stop here and we can wait for questions. Thank you so much.
Thank you so much, Shirvi. Yes, we'll go to questions at the end. Now we'll go to our final presenter. So this will be Peter Lilienthal, the Global Microgrid Lead for UL and previous CEO of Homer Energy. So if you're an engineer, you've probably used Homer before on energy system modeling. And Mark will give us a presentation on the Homer Powering Health tool for system sizing and modeling. So over to you, Peter.
Well, thank you. And thank you all for joining. And I'll just go right to the next slide, please. And just give you a little background on Homer and who we are and how we got into this particular thing. But I do want to, I'll probably say it several times, emphasize a point that both of the previous speakers made about the importance of capacity building. And that's been sort of the whole focus of why we created this software in the first place. It grew out of the Earth Summit in 1992, where NREL was tasked with how can we help developing countries use renewable energy. So I created the Homer software as part of this Village Power program that we created in NREL, very active in the 90s. It's been continuously upgraded, since then. Upgrades, as I mentioned, in 97 and 2002. By 2009, it became obvious that this wasn't just a research project anymore. So we spun off Homer Energy as a private company with the exclusive license to continue to enhance, update, support, and distribute the software. In 2010, we had a project with USAID, U.S. Agency for International Development, to create Powering Health, and that's sort of what the basis for this presentation. So I'll talk more about that in a minute. A big upgrade in 2014 to the current version of Homer Pro. This is a tool for designing these kinds of systems, and both of the previous speakers talked a lot about the importance of design. This is designing a sustainable system using solar power, batteries, backup generator probably, is a much more complicated process than just procuring a diesel generator. So we have, so that's our role in the world, is to give people tools, especially local people tools, to help with that design process. Just a year and a half ago, 2 years ago, we were acquired by UL. UL is a US-based company. It's been around since the 1890s. UL is the standards organization within the United States that certifies the safety of every piece of electrical equipment, medical equipment, literally billions of products that have the UL stamp on them, that they're safe. And in the last 10 years, UL has gotten much more interested in sustainability in addition to just safety. That's sort of related, and has stood up a renewables group that's 600 people strong with offices in 100 countries. So it's a great partner, and we're really happy to now be part of UL, with offices in places like Johannesburg, Dubai, Singapore, Manila, all over the world. The map on the right shows where people have used Homer to model systems, and you can see it's really all over the world as well. Over 250,000 people have used it. It's become kind of a global de facto standard for designing mini grids and small and off-grid hybrid systems. So I'll move on to the next slide, please, and talk a little bit more about what I'm going to demonstrate now is the software. It's a web-based tool called Powering Health. As I mentioned before, it was originally funded by the U.S. Agency for International Development as part of the President's Emergency Plan for AIDS Relief. That was over 10 years ago. At Homer Energy, we have felt this is an important tool, so we have kept it up and enhanced it a little bit over time and maintained it, and it's still, we'll show it to you in a minute. Last year, we were contacted by the World Bank. SMAP is their management assistance program. As the COVID pandemic started to roll out, and they recognized, so this is going to be a real problem, and we need a lot more capability in health clinics around the world to modify Powering Health for COVID relief, which we did, and that was over a year ago now. And then just a few months ago, or just really now, we're just now starting this project, a new project with the World Bank, to broaden Powering Health for broader energy needs in focusing on displacement settings. So I hope the people in the audience here can help us as we modify the software to be as useful as possible for the displacement settings. The whole goal of Powering Health is that it's intended for non-engineers. So Homer Pro, I like to think you don't actually need to be an engineer to run it, but it's a lot more. It really gets into the design of of these hybrid systems. But we wanted also a simpler tool that can be used much more quickly, can be used by maybe healthcare facilities or healthcare practitioners and government planners and NGOs, et cetera, that aren't energy experts. So we've included a lot of explanatory information in it. One of the things that I think is really important about it is that it's easy to use, and it creates an initial design very quickly, but it also creates a Homer file that can be opened in Homer Pro for the later stage design, for more detailed design as part of this procurement process. So you start with this Powering Health, you get an initial design, you get a Homer file out of it, and you can open that in Homer Pro for further design. With that, I'd like to actually show you the software, which means having the control passed over to me. And okay, here we go. Give me a second to open the right screen, show my screen. So hopefully you're seeing.
Yes, we can see your screen.
Okay, great. So there's the URL at the top, poweringhealth.homerenergy.com. And as you can see, we want to give credit to USAID for the original development. SMAP is the one we're currently working with, and we're very excited to get started on a modification of this for these displacement settings. But that project literally is just getting started. And I mentioned all of the explanatory materials. So everywhere you see this little diamond, you can open it up. And there's a lot more information here, and everywhere there's a little blue link. Now this is a multi-page. Oh, wait a minute. Oh, sorry, it opened in a different window. It's quite a substantial document here that not only talks about how to use the tool, but gives some background information about different levels of energy efficient appliances, et cetera, et cetera. Let me go back to the tool here. So I'm not going to go through all of that, just to know there's a lot of information here, but I am going to show you sort of how to use it. So by clicking on a map, and since Mark started with South Sudan, I'll just use that. That downloads the solar resource data. Then if there's an electric grid available, you can talk about what the price is and how available it is. Is it only available for 6 hours a day or something like that? The Homer Pro, you can have random outages as well, but this is a simple tool. And then a few very simple inputs like what's the price of diesel fuel? And that should be the delivered price. And in many of these places, one of the biggest challenges with diesel is just the logistics of getting the fuel to the site. And so you should include all of those logistical challenges and costs as well. Homer is going to find the least cost system, so costs are very important. The least cost system to meet the load that's the required load. So we've kept this really simple. Homer Pro itself has many, many more inputs. And then we have 4 templates, if you will, of 4 different size health facilities. For this displacement settings, we may want to go beyond that, and like Mark talked about how different a small system and large systems are. You know, one of the things that's really struck me about this sector is just how diverse this displacement settings are. So these are just templates. They pre-populate this large this sort of spreadsheet with I pick, for example, a small inpatient clinic. When we worked with some experts who said, okay, who thought these were good examples. So they're saying, okay, well, that might have 4 lights in the maternity ward. Here's their size and their average power. They don't run all the time. And we broke the day into 3 time periods. You know, Homer Pro wants 24-hour load, but we simplified it here. So you can see there's quite a long list of things here. Things like refrigerators, you know, probably run all the time. And I'm not going to show all of this stuff. I'm just going to scroll slowly through it, just to give you an idea. It also includes things like energy for the staff, for housing. Water pumping is a super important load, of course. And this is important to mention, is that you can add as many additional things as you want, whatever they might be, additional equipment, whatever it is. I'm not going to. And then how many, what's their peak power, nameplate power, but then it probably doesn't use that continuously. So we need to know the average power so we get the energy load over the course of the day and its schedule. And then you calculate. Now, Homer has sent this data off to a server, and we're running a Homer Pro really with a whole lot of default information, but with this data that we've included here on a server, and it's simulating the operation of maybe hundreds of different systems, and ranking them by total cost of ownership, net present cost, or life cycle cost. And what we're showing here is the least cost system of each configuration. So, you know, this is a hybrid system with PV, batteries, and a genset, but here's without the genset, here's without the PV, and here's just a genset. And for that small clinic, it says the least cost system has a 5 kilowatt generator, has a backup generator, is probably there already, and 14 kilowatt hours of batteries, and 5 kilowatts of PV. And here's just some initial summary information about it. Interestingly, you can avoid, for this small system, you can avoid the backup generator, but you're going to need to almost triple the size of the PV array and have a larger storage. The operating costs go down a little bit, but the capital costs go down quite a bit. So that generator, even though you're only using it 208 hours a year, and by coincidence, that's the same number of liters per year, that's just a coincidence. So you're not using it very much at all, but it's saving you something like $9,000 in capital costs. If you were trying to meet this load just with a generator, your fuel consumption would be 20 times greater. Your capital costs, of course, would be a lot lower, but your operating costs would, again, be 20 more than 20 times higher. So this gives you an overview, and Homer modeled many different configurations of each of these system types. But if I click here, I can get more detailed data on the system. It's got to re-simulate it. While it's
Peter,
doing that,
sorry to interrupt. If I could ask just to wrap up in the next minute, if you don't mind.
Sure. There's also an input report you can get, and as I mentioned before, you can download the actual Homer file to use it in Homer Pro. And maybe I'll leave it there. You'll just have to take my word for it that this is generating a more detailed PDF showing just more detailed information about all of the components and how they operate, et cetera. So I just want to conclude. So I just by mentioning how, oh, there it is, how important it is to do this kind of design, how important it is to get local people up to speed on how to do the design. And I think this tool is a great starting point, because it's for people unfamiliar with the sector, it's a great way for them to get started because it's relatively easy to use. And except for the very smallest system, it almost always is a hybrid system with backup generators, which are probably already there anyway, because they're the first thing to come, and how to hybridize them. But there's so many trade-offs, there's so many degrees of freedom that is why you need a piece of software like this. So thank you, and I'll turn it back over to the organizer.
Thank you so much, Peter, and to Mark and Surabhi as well for the presentation. So we have about 15 minutes for questions. So many people have been asking questions throughout the presentation, and I'll start that now. So yeah, I think we can go back to Fernanda's screen. And Surabhi and Mark, if you don't mind putting on your camera for the discussion. And I'll start with the first question. That will be going to Mark, which I think is an interesting one. Are system installers given a chance to participate in the system design, for example, in the NRC example you gave?
We try to give them their input, so that's why we have output-based design parameters. So we tell them what the outputs are, what the amp hour or what the energy needs are, what the minimum size are, and then they provide their so that was one of the main things that I was interested in doing. The two pieces of work I did with these two clients that I mentioned is because every supplier has a different type of equipment, SMA, Outback, Victron. These are all different pieces of equipment. So you want to give a tender which enables all of the suppliers to provide their equipment. So the answer to the question is yes. And the reason that we're able to do that is because we use output-based parameters, and it doesn't define what the technology should be. I mean, they can choose whether they want to supply lithium-ion batteries or whether they want to supply in their tender OPZS batteries. It's up to them.
Thanks, Mark. And I guess the prerequisite there, and as you mentioned, is to really have the expertise internally to be able to provide those output-based. Thanks, it's useful. I think a question to all. The question is that humanitarian operations require speed and implementation. So what would be the solution in that case, as in how to convince management to really invest time in renewable energy systems when they're kind of used to delivering a quick generator installation? So how to do that in a bit of an emergency mindset context. I don't know, maybe Mark, if you want to start, and then we can turn over to Surabhi.
That is the challenge. I think we need to start with humanitarian organizations that have focused on this first, because the ones that are going to go with generators are going to go with generators. But there are, in the last 2 years, I've seen the changes occurring. The donors that are funding these organizations are shifting. So the first thing is, let's work with the groups that want to go green, and help them first. But secondly, you want to convince them they need to be connected with a competent solar company. So my suggestion to answer that is to bring in the competent companies, and to avoid the backroom procurement deals. And so maybe we need to get the qualified solar companies, both regional and international, to the table, and have them talking to the agencies, and have them meet in round tables and get to know each other. Because I know, like PowerGen, PowerHive, standard microgrids, these are groups that put in great mini grids that are really appropriate for the humanitarian sector, but they don't target their marketing for those sectors. Over.
Thanks, Mark. Really good insight. I think that was kind of cross this really need to work cross-sectorally. So then maybe over to Surabhi, and maybe a bit more focused on health systems. What would your insight there be?
Yeah, thanks, Amy. So, I mean, I think there are two levels. One is to sort of talk about the economic implications itself. We know that organizations are right now spending a significant amount on diesel generators and the cost of diesel. So I think one part is to have those economics in place, where you are comparing the cost of decentralized solar and efficient equipment with what they're currently spending on diesel, and to have that available for that particular health facility, whether that's a small health post or a main hospital, and that can be pre-work that we have in place. The second is, the more we think about kind of packaged energy system designs, depending on the kind of health services that need to be delivered, the faster it becomes to think of deployment. So you know that for this small health post that has to have just vaccine storage and very basic maternal care, there is a certain compact option of energy health system. And so as soon as you have that situation in place, you're able to say that this is the kind of solution we need to put in place, and these are the kind of energy system requirements. And I think I agree with Mark that there needs to be a mapping of the energy sector, and perhaps that's kind of our responsibility as the energy sector engaging with humanitarian, to have a mapping of who the appropriate suppliers are, who the energy enterprises are that can play a role in this emergency scenario.
Thanks, sir. Yeah, go for it, Peter.
If I can just weigh in, and it's to build on Mark's point, or both people's points actually, that this is a process. And in an emergency setting, maybe they send in a generator right away, but that's the beginning of the process, not the end of the process. And to do the sustainable system properly is going to take a little bit of time. So probably the diesel generator went in first anyway, and what we're talking about is how to retrofit, or what to supplement, or how to create a hybrid system for the medium to long term. So it's not an either or, really. It's if it's an emergency, you get something in there as quickly as you can, but you don't stop there. That's the beginning of this design process.
A great point. Thanks, Peter. And I think that's also a big issue to really focus on, is transitioning to renewables earlier in the process rather than many years down the line. So I think it's very pertinent. One question to Surabhi. It's the participant asks, from their experience in electrifying healthcare facilities in Rwanda, power systems monitoring after installation and commission is very critical. If you need to manage the usage and advise trained staff on how to use the system. What are your thoughts on this?
Yeah, completely agreed. And I think we're trying to do that with as we start to do larger program designs, to try and see if we can have data monitoring and data loggers included within the energy system itself to be able to monitor that remotely, and to be able to provide appropriate training to health staff to also look at how you monitor those energy, the energy system and the battery charging, the kind of training that you provide for basic maintenance at the health facility level, and then at the level of the organization or the health department that is managing all of these facilities, to be able to have a link with the energy enterprise that has a sense of what the regular consumption is. And these trainings with health staff are not a one-off thing. They have to be repeated also because health staff change. Facilities have one health staff 1 year and another one the next year. So making sure that the trainings are not a one-off thing, but rather a regular feature, just like they would for their regular, health delivery trainings and the frequency of those.
Thanks, Ravi. And maybe extending that question a little bit, again, alluding to the experience in South Sudan. Mark, was there kind of how were power systems monitoring built into to your experience, and were there any barriers or anything in terms of actually putting those monitoring systems into place?
Well, actually, of the 11 sites that we put in designs for, only 2 were done because NRC didn't have the funds to invest. So in the 2 systems that we installed, we installed the systems that one were Victron that have online inverters that were connected to the internet system at the offices, and then we hired a local technician to monitor the systems in Juba, South Sudan. So there is a local person who's one of the better technicians for solar in South Sudan, and he looks at he monitors the system for NRC. So that was kind of the local capacity building. To finish up, I don't think it's possible for a company based in another country or in a halfway around the world to be looking at the monitoring. It doesn't really help. What you want is someone who can look at the system and say, hey, go can look at the monitoring output and then call them up and say, hey, go check the battery, or hey, you put a huge appliance on, can you go check what's happening? It doesn't work for someone sitting in another country halfway around the world. So monitoring goes with local capacity building.
Thanks so much. Really useful. There's one quick one for Peter. Is there a fee for the use of Homer?
The Powering Health app is completely free. The Homer Pro has a 21-day free trial, and we have discounts for researchers. But what I demonstrated was a completely free tool.
Great, thanks so much. And then I think one maybe for all of you to reflect on as we start closing out. I think on this topic of companies really being involved. So how can renewable energy companies get involved in displacement settings and trying to power healthcare facilities and humanitarian facilities? How can they get involved now? And yeah, just how can this kind of, how can we actually enter provide the opportunity to the private sector to kind of work directly instead of through procurement, as Mark said. So maybe Mark, if you want to start.
That's a really good question, and I think that's where the aid community comes in, the humanitarian organization donors. I think they need to fund these cross-sectoral engagements, because my experience working, staying in a hotel in Juba and seeing the dealing that goes on with procurement companies. I mean, when I was doing the job, I had people say, yeah, I can buy solar panels. I'll give you a cut on this. So I think what needs to happen is the humanitarian agencies need to have platforms to talk with the the providers. It's a process, as Peter said, and so we need to recognize it as a process. So we need to start the dialogue.
Thanks so much, Mark. Maybe any closing thoughts as well from Surabhi, and then over to Peter.
Thanks. Yeah, I mean, I think the crux of the issue is actually how do you get energy to healthcare facilities in these regions, right? So it may be that an NGO is best equipped and the enterprise should actually, implement and install the equipment, and then the NGO is capable of actually running it as a delivery model with local technicians who manage it. So let's not sort of bucket ourselves into just having renewable energy enterprises that have a full control or whatever, have to have the full control of the energy provision in humanitarian settings. I think it has to be customized based on the need in that area. And if a renewable energy enterprise is not based locally, then let's look at those delivery options where the local energy partner or the health partner of a humanitarian aid organization gets involved in the last mile delivery with specific technicians focused on the energy system management.
Perfect. Thank you, Surabhi. Then maybe one last quick reflection from Peter and we'll close.
Yeah, I just have two really what I think are pretty important thoughts, though. And one is just to re-emphasize the value of local capacity building. That's the only way this is going to work, and that includes both. By local, I mean the host community or in people in the region, but also people within the humanitarian organizations who've been focused on many other things, whether it's food and water and health, et cetera. Somebody, as both speakers have said, needs to be focused on energy, needs to be their job. That's the single most important thing. And the other point I just want to make, because I'm starting this project with the World Bank to modify that app I showed for displacement settings. I would just love to get as much input as possible from the people on this webinar to help us figure out design that new app and what's most valuable for this this sector. So we're just starting, so we'd love to get input, and I gather this group is a great group to get that input from.
Thank you so much, Peter. Great. I see you're.
Sorry, just one quick thought I had was around, I think what a great role for private enterprises would actually be to innovate on the kind of design options that exist for humanitarian settings. And if you can then use that and then build local capacity on that, that might make a large difference in terms of what is available on the ground to put up immediately, to allow mobility, to allow portability, and so on.
Great point. I think that's a perfect closing thought. So I wanted to thank you all for your presentations and everyone for staying on the line as well. And I think with that, we'll close. We'll send out a feedback form after the webinar, and we'll send out the links for additional resources. We have quite a rich series of presentations and are working on other knowledge sharing kind of activities for the wider community. So keep a lookout for those. And then we'll have our third session coming up on the 23rd of November, focused on different case studies. So thank you all again to the presenters. Really appreciate your time and sharing such really rich expertise. And to the Energypedia team as well for all the facilitation. And with that, I wish you all a great morning, afternoon, evening, and hope to see you at the next webinar.
Thank you.
Thank you. Bye.